Thank you once again for staying with us on this morning on ITV. We're still here, coming to you from our studios in Mpapi Hills, right here in Abuja. And we're moving on to the next topic of the day. We're going to be looking at COVID-19, impact, implication of planned compulsory vaccination of citizens. We know Nigeria has been faced with COVID-19. Not only Nigeria, the entire world was caught unawares last year. No, 2019 to be precise. That was when it was discovered in China. And then by 2020, the entire world has gotten its own fair share of COVID-19, Nigeria inclusive. Last year, Nigerians went through lockdowns, restrictions, and all of that. Yes, we are survivors. We survived. And the SARKI has come in the form of vaccination, and which happens to be very, very free. The government is not charging anybody for it, but there are still controversies concerning this vaccination, concerning this vaccination, being that there are persons out there who still don't believe COVID-19 is in Nigeria. And there are other myths that have been thrown up by people concerning the vaccination. These are issues that we will be looking at as we discuss this matter today with my guest on set, Dr. ABDULSHAHID SARKI. He is a consultant nephrologist and physician. You're welcome, sir.
Thank you for having me.
Well, COVID-19, it has become the national anthem in this country, and now vaccination. First of all, I would like to, you are a medical practitioner. Coming from you, people will believe. Yes. So what is it about this COVID-19 vaccine? Because there are people who do not even believe that there's COVID-19 in the first place, not to talk about the vaccine itself. And there are also conspiracy theories concerning this vaccine. But what is the actual thing about COVID-19 vaccines?
Okay, COVID-19 vaccine is aimed at boosting the immunity of one human being, so that at least when you come in contact with the COVID-19 infection, the immunity that has been stimulated in your body can be able to take care of that infection. So that's the rationale behind COVID-19 vaccine, and then so that our system will be stimulated, and then we'll have a strong immunity against the COVID-19. So that's the rationale behind COVID-19 vaccine. And we have so many vaccines on ground, which already we have started using them. We have the Pfizer vaccines, and then the BioNTech vaccine, the Moderna vaccines, and then even the China vaccines. But even though we have not started using the China vaccine in Nigeria. Basically, you know, from how the vaccine evolved is mostly initially from the lab, which the efficacy of the vaccine has to be ascertained, and then other side effects related to the vaccine has to also be looked into, and it's based on phases. But because COVID-19 has been a pandemic, so it takes longer time actually for a vaccine to be evolved, because it has to pass through phases. We have the preclinical and then the clinical phases. Preclinical is just to ascertain the efficacy, and then the toxicity. And then the clinical phase is when you start using it in humans. Which initially you start with a small number of people, and then you document the efficacy of that drug, and then also its toxicity, and then you move ahead to another phases, which you increase the number of people, and then from there you also phase 1, phase 2. Then when you reach to phase 3, you try as much as possible to gather a lot of races together, which you administer that vaccine, and then from there, when you see that the vaccine is efficacious, efficacious to those races, and then you document the efficacy and also the toxicity of that drug, That's when you go for licensing. So because of the rapidity of COVID-19, because COVID-19 pandemic caught the whole world unaware.
Unawares, exactly.
Yes, it's become pandemic. So that motivate the scientific community to see how
that
they
kind
can
of speed
bring
up
out the vaccine in rapidity. So in so doing, they have to try to see how they can combine one or two phases at the same time, so that they can be able to produce a vaccine that can save the whole world. And then we're able to do that, so that actually some of the vaccines were recorded to have 95% efficacy, while some be recorded to be around 60% efficacy. So what does that mean? Because if you are saying 95% efficacy is when you vaccinate 100 people, out of 100 people, 95 people will be fully immune against the COVID-19. So that's based on the efficacy of that drug. So then the vaccine came on board in rapidity, so that to save the whole world. And then people were admonished to go and become vaccinated, so that to achieve what we call herd immunity. Herd immunity is when more than 60% of that population are immune. So meaning that you reduce that level, that infectivity of that COVID-19 to the barest minimum level, so that at least it will be a small significant number of people that will be infected with that COVID-19.
Okay, so that is to say that COVID-19 is just like any other vaccine that we have on ground.
Yeah.
But what is this controversy going on about the vaccine? We've seen videos of people claiming that after taking the vaccine that it became magnetic. In fact, I watched one who placed his phone here, and I was saying that, look at it. I placed my phone. It's been like this. It's been like this for like 5 minutes. That was what the person is saying. So what is it about this? And people are believing it, especially Nigerians.
Yes, I also watched that video.
There's also a video of someone who said that if you take the vaccine, you may die after 2 years.
Yes, yes. I was. Let me cut our attention. I was privileged of recent to deliver a lecture, which I tried to palpate the pulses of those audience that I was privileged to deliver the lecture for. So these are some of the pertinent issues they raised, and then they were saying that yes, one of the reasons, yes, they said COVID vaccine has been given, and then
in fact some people said it came switches on and
yes, metallic substances attached to that. And then another thing, they were saying that the immunity is not lifelong, and then by the time the immunity elapses, that your whole immunity will collapse and then you will die. And then some were also raising an issue regarding how even the vaccine was evolved, how the rapidity, why will the vaccine...
Did you not hear about the 666?
Yes. What?
666, the Antichrist.
No,
there were some that said that it is that is a chip that is implanted in humans.
So actually what those people try to do, because they have mischief in their mind and they are trying to send a misinformation about the vaccine to other people not to take the vaccine. You know, if we that did physics before, we know that when you rub two objects together, I think they tend to become charged, and then when you attach them together, they tend to come together. So if you see those people that were showing those videos, they have to rub their skin before they attach something to it, so it stays for some time, because they have already generate some charges in their skin, and then when they break an object or either a metallic object, it tends to come together for some time, and then later
so that's why you said if I wet my skin now and place the phone, it will actually
we can still do, if you can get a piece of paper now, and then you get a biro and rub the biro, okay, in a hard surface, and then you bring it closer to that paper, it will stick.
Okay.
Yes, try it.
Okay, so this is the trick.
So this is the trick. So some people are trying to see how they can misinform the public about that. So they were able to bring some things together, and also even the issue of putting some bulbs that were
yes.
charged. You know, already if you have generated a charge by rubbing your skin, when you bring those bulbs closer to that charge, it will also pick up a light. So they try as much as possible to see how they can put bias in the mind of people, so that people will not accept those vaccines. So a lot of people, yes, were convinced that those things are true, and people become reluctant and skeptical to go through the vaccines. And then they are trying as much as possible to look at the other side, or the side effect of those drugs, and try to make it a form of hyperbolic in such a way that they exaggerate those aspects, so that at least people will be reluctant.
Knowing fully well that there's nothing that does not have its own side effects.
Yes. Each and everything. When they asked me about issue of the side effect, I told them that as low as paracetamol, whenever you take paracetamol, it also has its own side effect.
Yeah.
So that's how also the vaccine also has its own side effect. So most important is you look at the benefit and then the risk. You weigh between the benefit and the risk. If the benefit outweigh the risk, you go for it. Yeah, you go for it, because COVID-19 is a deadly disease, and a lot of people have succumbed to this deadly disease, and it has affected the whole world, and then the economic aspect as well. So I think this is the right time for us to stand against this COVID-19, and the only way that we can stand against it and see how we can become successful in the fight against COVID-19 is for us to embrace COVID-19 vaccine, because if substantial amount of the community were immune against it, so I think it will be reduced to the minimum, barest minimum level, and then it will not be of public health importance at all again. Okay,
doctor, this COVID-19 came to Nigerians unawares, like every other country, and so many Nigerians do not, to them it is the first of its kind. I would like you to share with Nigerians, had there been other pandemics in the past? Because people do not believe anything like this had ever happened in the entire world, that this is like a first.
Yeah, there are so many pandemic that has occurred in the past, even in 90s, that's in 20th century, not 21st century. We had the influenza pandemic. As of that time, it was even so deadly because antibiotics were not discovered as of that time. So whenever people were infected, so it's like a death sentence as of that time. Unlike now that we are privileged to have some antibiotics that we can use to also boost the immunity in such a way that it can fight the COVID-19. So apart from even those influenza pandemic that we have had as of that time, we also had some pandemic that do occur, like the severe acute respiratory syndrome, COV1, because this COVID-19 that we had 2019, we are calling it SARS-CoV-2. It's also a coronavirus. So there was a time around 2001, 2002 when we had a pandemic related to the severe acute respiratory syndrome, COV1, and also
was it the one that was said to be airborne?
Yes.
There was one that was said SARS. Yes, I remember SARS. That was said to be airborne.
So, and then another thing also, we have MERS, which was called it Middle East respiratory syndrome, which was also in a certain way pandemic as of
it was discovered in the Middle East.
Yes, in the Middle East, because you tag an infection pandemic when large number of nations were affected. So that's when you said that this virus is pandemic, and that, or this infection is pandemic in another word. And then another thing is, you know, epidemic is when just a local population you have
okay, can we tag Ebola a pandemic?
Yes, Ebola, yes, because even though so many nations were not affected, but so many countries were affected, so it was also tagged pandemic as of that time, and it's more deadlier even than the COVID-19, because it has been recorded almost 50 to 60% of the population when infected tend to die from the.
And up to now, I don't think there's a vaccine for it.
Yes. Research is ongoing about Ebola vaccine, and then. I'm
smiling because something just occurred to me. People seem to think because it's an African disease, that's why no vaccine has been discovered yet.
Still they are trying,
because they are trying to compare it with the speed at which the vaccine for COVID-19 came on board compared to Ebola. The Ebola outbreak, Nigeria had its own fair share in 2014, right? Yeah, yes. And all of that. Other countries like DR Congo, they're still struggling with it. So some persons just see that, well, because it's an African thing.
Yeah, actually it's another factor, that commitment towards how to evolve a vaccine require a lot of resources, because scientists have to go to the lab, and then they have to give all what they have so that they can see how they can bring out something that will save the whole world. So sometimes the commitment tends to be low when we compare the development of vaccine, especially in an African setting. Yeah, especially, let's say, for example, in Nigerian setting, we are ravaged by Lassa fever, but up to now,
in Nigeria, it's a yearly thing.
So every year. There is no commitment in such a way that a lot of huge resources will be pumped into research to see how a vaccine can be generated in that regard. And people tend to follow where they see funding is coming, so that at least they can do something related to that.
Okay, we're still talking about the vaccine, the COVID-19 vaccine, which everybody is expected and required to take. My next question is, there has been, like, for instance, the government is saying that it is compulsory for civil servants to take the vaccine. For me, I would understand, because I go out every day and I know that if I don't protect myself, I may as well consider myself being the person that will bring it back home. And I would like to say that is the point. But Nigerians don't understand it this way. They see it as trying to force it down, and some people are now saying that, okay, we told you that this thing is not good, and that is why they are forcing people to take it. So what will you say to that?
I think everything boils down to advocacy. I think when people were fully informed about the benefit of the vaccine, I think willingly, without any inducement, without any coercion, without any threat, I think people will be willing to go and present themselves to take the vaccine, because they are fully convinced about the benefit of those vaccines. So I think what we need to do, still we have to strengthen our effort toward advocacy. Let people be informed how important it is about this vaccine. And then when people become more aware and they are willing to accept, I think that will go a long way in mitigating the infection of the COVID-19, and then people will also be willing to see how to become vaccinated, and then we'll be able to reduce the menace and the surge of the COVID-19 in our community.
Okay, talking about the vaccine, is it now, can somebody just walk into any hospital and say, I want to take the vaccine?
Yes, you can do that. There are so many, especially in this FCT, there are designated hospitals where you go and get the vaccines. Yeah.
Okay, designated hospitals, not just any hospital.
Yeah, designated hospital where you walked in and then you do the online registration. You can even do it at home, and then you just walked in and then get vaccinated, so that at least your data can be captured based on that you have been vaccinated with the COVID-19 vaccine.
For me, while I'm talking about this COVID-19, I am not too worried about the urban areas, because I know it is very, very available as we speak, except you choose on your own part not to go and get it. Now my concern is the rural areas, our rural communities. Parents in the village, siblings in the village. You are in the field. As a medical practitioner, have you seen any effort like taking this down to the grassroots?
Yeah,
not the grassroots in Abuja.
Yeah, it's doable, because the vaccine, COVID-19 vaccine, is not the only vaccine that has been on ground in Nigeria. And then the Nigerian system has been so organized in terms of immunization, because polio vaccine has been on ground. And then we have the expanded program of immunization, where the immunization has been able to touch from the tertiary level of health delivery up to the level of the primary healthcare centers. So I think it's doable, because the issue is that each and every local government, if we look at each and every local government, has at least 4 primary health centers, and then at least 1 comprehensive health center, and then 1 general hospital. And then we also have the specialists, and also we have the tertiary hospital. And all those places provide vaccination. So I think if government can utilize those primary health centers, I think you go a long way, and in trying to see how significant or substantial number of the population are vaccinated with the COVID-19. But still, also advocacy has to go down to that level. It goes from at the level of the tertiary level, that's at the federal government, up to the level of the local government, so that people will be willing to take the vaccines, and then we'll be able to have a significant number of populations immunized against the COVID-19. So, and then we'll reduce the burden of the COVID-19 in our setting.
One important question I would like to ask is, does it mean if I take the vaccine, I will not be infected even if I come in contact with somebody who is infected with COVID-19?
Yeah, if you have, if the immunity has been enough, the infectivity will be very, very low. In fact, the chances will be very, very low for you to be infected with the COVID-19 virus.
Okay, what about people who have a terminal illness? Let's say like cancer, like HIV. Does the vaccine have any, will it have any serious side effect on them?
You know,
but these are some of the issues that people also want to know.
Yes. You know, each and every vaccine, you know, it depends. When you have live attenuated virus, live attenuated
and people suffering from high blood pressure.
Yeah. So you know, when even the vaccine came on board, I think the population was stratified based on the urgency of the need of the vaccine, which the elderly, based on the age, because when the COVID-19 came on board, it has shown that people that are elderly and people who have comorbidities, who have hypertension, who have hypertensive heart disease, who have lungs disease like chronic obstructive pulmonary airway disease, and those who smokes, has shown that they come with the severe form of that disease, and the risks, that they have high risks of dying from the COVID-19 virus infection. So some of this population were stratified, and they were identified as those that have the urgent need to get vaccinated first, because some of them, like patients who have chronic kidney disease, their immunity is low, and then they also need those vaccines, because when they come down with the COVID-19 virus infection, they come with the severe form of that infection. So they were stratified, and then they were admonished to go and take those vaccines. The only bone of contention, because majority of those vaccines, you know, it's not like the actual virus that they inject. Yeah, so it's the RNA. They look at the sequence of the RNA sequence of the of the COVID-19, and then they form a replica of that RNA in the lab, and then they try to stimulate the immunity, so that at least when you come in contact with COVID-19, because the RNA of the COVID-19 virus resemble the previous lab RNA that was formed in the lab, so the antibodies will try to attack it. So based on that, so I don't think there's any problem based on that.
All right, finally, before I let you go, what will you tell Nigerians as to concerning taking the vaccine? Your final word to Nigerians?
COVID-19 vaccine is safe, and then it's safe, and then the benefit outweigh the risk, and then it will also help to see how our population will reduce the prevalence of this infection, and then in so doing we try to see how we can reduce it to the barest minimum, to the level that it will be of less public health importance, and then our community will be safe, and we'll be proud enough to beat our chest that we are able to conquer COVID-19 virus infection.
I don't want to go into our community as far as healthcare is concerned. So COVID-19 vaccine.
Yeah, then the commitment of the government, as yes, we know the government is trying the best, but also we also want the government to strengthen in advocacy. All those misinformation that people were raising, they have become pertinent concerns of those individuals that will receive those vaccines. So those concerns need to be addressed for those people to accept the COVID-19 vaccines. So when we strengthen in advocacy, I think people will be willing to come on board and be able to accept, because this is not the first time. We have so many vaccines on ground, and we knew how we were able to overcome those challenges. We have the polio vaccine, and the way people were not able to accept, but later people have seen the benefit and they were able to accept to allow their children being vaccinated. So also other vaccine, childhood vaccines, that initially some people were not willing to bring their children on board, but later when the advocacy has
became stronger
and people were becoming more aware, people start bringing out their children for the vaccine.
Right.
So
I remember there was 1 year we went to Bwari, to be precise, and well, you know, it was during this polio vaccine. And so we went into a school, an Islamic school. So as soon as the people saw us coming in, they took off in different directions. They were saying, you've come. So until the chief of Jew, he was with us there, so he had to begin to, he spoke with the people there, and now they started calling them back, and they came back. So advocacy is actually the key to this. Well, thank you very much. It's been very interesting having you on set on this issue. It has been an eye-opener to me. At least some of my fears have been allayed. I've taken the vaccine. Some of my fears have been allayed. We've been talking to Dr. ABDULSHAHID SARKI, a consultant, nephrologist, and a physician. He has done justice to these issues surrounding the COVID-19 vaccine. If you're one of those people who still think that COVID-19 is not real in Nigeria, then you should have a rethink. COVID-19 is real in Nigeria, and the vaccine is real. There is nothing like being magnetic or whatever. He has explained it, so you can try it to see how it does. I think I'm going to try that so that I will know, because those videos, they are really chilling when people watch them. Well, stay tuned for we're bringing you an interview on the Naira depreciation. We all know that the Nigerian currency keep plunging down. Just sit down and watch this interview.